off, but when I go to the doctor, then things tend to compile and snowball, all those things, right?
Right.
What I think we have to understand, we spoke about stress, it's not you going to the doctor that causes that situation to now be negative or be more impactful. It's how you view it. So the stress that you put on that visit, the stress that you take out of that visit, then makes you feel worse,
Yeah,
right?
but then also remember there's a historical context there as well
Okay.
with Black people. There's for a lot of us because of
Yo, thanks for locking in and welcome to Gym Life. Today, my guest is a good friend and works here in Los Angeles, California as a physician. We're going to be talking about preventative health and chronic illness. You're not going to want to miss this. Welcome back, Eve.
Great to be back. Thanks for having me.
It's funny, I know when I told you the topic, you hit me back like, yo, this is going to be a good one.
I definitely.
Yeah, because I
Yes.
think it's something that we talk about so much, like in leisure time, anyways, and something
Right.
we're both very passionate about from like just separate angles, right? Separate
Right.
perspectives when we're talking about something like preventative health and wellness.
Exactly.
And there's so many things that we're gonna cross when we talk about
Absolutely. It's a lot to unpack here. We may have to do this in a two-part series because there's a
it.
lot of information here.
Yes, oh,
Yeah.
for sure. So, okay, so you know we're working out.
Yes.
All right, so I'm gonna break down the workout for you. Today we're gonna, we picked out our hand weights. First thing will be one arm flies. So with the one arm flies, you want to sit and have a nice strong core, and then we're gonna go 10 on each side, right? Well, we're back here. So we get 10 on the right side, we're gonna go 10 on the left side.
Okay.
After that, we'll have both weights, and we're gonna go 10 squat curl, okay?
Okay.
After you do 10 squat curl, then we're gonna go down into a plank, and we're gonna do 10 mountain climbers slow. 10,
Right.
9, 8. After the slow climbers, then we're gonna go side lunges. 10, 9, all the way down to 1. All right?
Got it.
And of course, we'll start with our warm up first,
Yes.
and then we'll get into it. So let me get this timer going,
Okay.
and then we all
Workout.
running.
Get ready.
So how you been doing? You getting some good workouts in?
I've been getting some good workouts in. I've been running a lot more. My stamina is better than ever.
Okay.
And
Warm
Are you
up.
running outdoors?
outdoors and indoors. You know,
Okay.
that's the good thing about this beautiful LA weather, unless it wants to not be beautiful. But for the most part, I do a little bit of combination of both.
Yeah. Which one
Yeah.
do you prefer?
I really prefer outdoors, actually.
Oh, yeah.
Yeah.
Me myself too. I think me. I enjoy running outdoors more, but to me, when I want to get one in like real quick, then that's when it's like, all right, let me just jump on a treadmill for like 10, 15 minutes.
Exactly. That's the beauty of the treadmill is like you can you don't have to do a lot of preparation. You can just hop on it and get it in at any hour of the day. Whereas like if you're going, for me, I like to do it in the morning or like at least while it's daytime
Yes.
or, you know, light outside.
Oh, for sure. And you said it's been really helping with slimming down, huh?
Yes, with maintaining a decent weight, but I also incorporate strength training. Is super important, especially as we age. We'll talk about that a little more, you know, in the concept of preventative health as well, because like strength training and cardiovascular training are super important
Right.
in
Yes.
in the whole scheme of preventative health.
And it's
But-
funny, I always tell people that you want to try to get a blend. Some people are looking like to this answer, where should I do more cardio or do more strength? I'm like, just try to balance it out as much as can.
Balance is so important. But I have a lot of friends that I really encourage. You know, they're really big on just cardio,
Right.
and I really I'm like, the older we get, the more important incorporating strength training is because it
Yes.
has so many obvious and then not so obvious impacts on our overall health.
Right, right.
Like how we think, like our cognition, our cardiovascular health, our
Bone
heart,
density.
bone density, exactly.
So when we're getting into preventative health, what do you define that as? What do you define preventative health as?
So on a very simplistic level, it's being proactive about our health versus reactive.
Okay.
That's very superficial. And then also, I apologize in advance if I have to stop the workout because this is a passionate topic, and I'm like,
hey, listen, anytime you're making that point, I want you to.
Because I want to make a point, and then I don't want to sound like Darth Vader with my and be out of breath as I'm trying to make the point.
You're like, look, I may get into my make a point stance, all right? And really
but you can keep working out while I make my point.
While you make your point. Okay, we got that's a deal.
No, but like so, what are we doing now?
Here, back and then up.
Okay. So, yeah, so like preventative health,
more proactive
versus reactive.
Yeah.
But, honestly, I think that when people think of preventative health, just on the surface, it looks and feels like, making sure I stay, up on my doctor's appointments and, maintaining good exercise and eating healthy and getting good sleep. And those are all important factors in preventive or preventative health. But also, if we're really talking about what preventative health looks like, it really goes back to so much more than just what we're doing individually. It's really like even us, we got to go back to like the social determinants of health. And I'll tell you just personally, as a physician, I can give a patient the best care. A patient that comes to me, I can give them the best care in the world.
Everything.
But research has shown that me giving them the best care has like a 20% impact in their overall health outcomes. And the other impacts are, related to, the social determinants of health. Where do they live? Are they in a healthy environment? Do they have access to healthy food options? Do they live in violent neighborhoods? Are they exposed to a lot of trauma? And so that's really what we need to focus on when we're talking about true preventative health. Okay. So, and then it also, so my area of focus, and it's close to my heart. I'm a little biased because I did subspecialty training in pediatrics, and so working with kids and teenagers.
Yeah.
So preventative health in that component, in that world, looks like we talk a lot about adverse childhood experiences and toxic stress. So adverse childhood experiences like exposure to violence, abuse. Living in a volatile household, or even living in neighborhoods where they don't have access to healthcare, or exposure to racism early on. These are things that can contribute to toxic stress. Toxic stress is our stress response system is in overload, right?
Okay.
And so the studies have shown that kids who are exposed to toxic stress, specifically abuse, have a 50% increased risk of developing cardiovascular disease in adulthood.
Wow.
That's an example of, and also kids who are exposed to adverse childhood experiences, not just cardiovascular, they're increased risk for cancers, various cancers, substance abuse, increased risk for diabetes, and so many different things. Of course, behavioral problems, mental health issues.
Right.
And so we're really talking about preventing, true preventative health. We really have to start at what are we doing to make sure that our children and our families have kind of an equal so that there aren't as many disparities in them getting access to adequate, true health care, and making sure they have resources, access to resources. And so that's like really, so of course that may be a little deeper than, what we're, but I mean, that's true. If we're going to be honest about what true preventive care looks like, it really starts at, looking at those aspects, social and structural, policy changes that we need to make,
what you said that's key just stuck out is like you say, okay, you have a patient and you may only be able to impact 20% of their lifestyle and how things work out for them. But now it's almost like when you talk about children, that percentage must be even less because now you have the parents, right? So now you have parents,
exactly.
you have structural influences, systemic influences, all these things that are in place, right?
Right.
And then you go to see a doctor, a physician, and you give them the best care in the world, but that has barely any impact on everything, right?
Right.
So now it's not about individually making the best decisions. It's also about individually getting as informed as possible as like safe spaces to go.
Exactly. So that was going to be another, aspect as we talk about like, somebody watching this may be like, okay, you're getting a little deep on, I tuned into this because I wanted some tips on what I could do to prevent chronic disease. Okay.
Right.
But I think that's a good point. Education and like learning about, what are my risk factors and what can I do to educate myself and empower myself in order to prevent, if I know like my family history, and I know that I have a higher risk to develop something based on my family history or based on my environmental exposures, then I'm going to be more likely to start taking action earlier to try to, prevent that particular disease or various diseases from happening.
Right, which is you have to be informed. You
Exactly.
have to be informed.
Exactly.
And also, and I guess in addition to that, I really like the fact that you're tackling or addressing the systemic influences, structural influences, because now that means you have to be informed about where you are and what you're exposed to.
Right.
Like you have to know that.
Right.
And what we tend to do is think wherever we grew up or whatever our influences are normal. And we don't know too much outside of that.
Right.
And good, let me break. Yeah, we don't know too much outside of that. So it's very important to
drink your water.
And when we're talking from an individual level, right? The impact that our environment has, we can only know the impact if we see what our options are, see what the information is,
right?
And seeing like, okay, so when I go to this store, what kind of foods do they tend to carry, right?
Right.
Which is very important.
Yes.
Yeah.
Absolutely. Absolutely. Okay, what are we?
We're resting now.
Oh, okay, good.
So you can really get into your points.
We like the rest. Yeah, and so when we're looking at like from an individual perspective, there are different levels of there's different stages of prevention.
Okay.
So there's like the initial. I don't want to get too technical, but so there's like primary, secondary, tertiary prevention. But basically, the simplistic way to explain that is, so primary is, I'm healthy, I'm super healthy, and I'm just going in to prevent any kind of diseases from happening. So what can I do there? So, again, like what we said before, making sure you're eating healthy, eating the right things, knowing your risk factors, and, some forms of preventive health in that area are like preventing like development of diseases through vaccines. I know that's a touchy subject for a lot of communities, but vaccines are a form of prevention. Secondary prevention, so like you're targeting
exercise.
You're doing screenings. Okay. So like you're screening, like you.
This is primary now.
No, so we're on secondary now.
So what would you say primary is when you're making your daily decisions, what to eat, exercising?
Right, exercising. Well, so all of those, that's like gonna kind of go through each of them.
Okay.
But primary is really targeting, like from a healthcare perspective, we're looking at people who are already healthy, have no sign of disease.
Okay.
But we know that they have certain risk factors. So it's more about education, but then also, vaccinations, making
Okay.
sure they have their immune status is intact to try to
These are for
prevent.
people that are healthy.
For
already.
healthy.
Okay. Which highlights, even if you're healthy, but even more specifically if you're healthy, understand that every decision you make can push you towards the other way. Right?
So decision making. So like a more formal, so like smoking cessation programs and things like that. Those are so like basically more educational programs are a part of that type of prevention. What were you gonna say? I'm sorry, I cut you off.
No. That's essentially it, though,
Okay.
right? It's just like if you're in a healthy space already, physically, all those things, you have to still seek out information, not think you're just okay, because what preventative health addresses is like kind of counteracting the cumulative effect, right?
Exactly.
So you may feel fine, but you may be daily contributing to one day not being fine.
Exactly.
Right?
Exactly.
Yeah.
So we were really targeting, and unfortunately, healthcare, especially in our country, unfortunately, because in other countries they really do have more of a focus on this stage of healthcare.
Okay.
Unfortunately, here our healthcare system really ends up kind of putting more focus on the next stages that I'll get to, like tertiary prevention.
When something happens, now let's go.
Exactly.
Right.
And so then the next stage is secondary prevention is, like I said, you don't really have symptoms, but you're getting screenings. So you're screening yourself for women, it's important to get like a pap smear to screen for cervical cancer, because you can find that there may be some abnormal cells that can lead to cervical cancer. But if I catch it early, then we can just nip that in the bud.
Let's highlight that.
Okay.
There are certain things that if you catch early, it's nothing.
Exactly.
You get it, you handle it, it's done.
Yes.
And that same exact thing, if you wait and don't get a screening, could turn out to be much more detrimental just because you didn't catch it early enough.
Yes, another classic. I like to give examples. Unfortunately, our
flies first.
what are we doing?
The one
Sorry.
on flies.
Oh, sorry.
No, you good.
Sorry, y'all. Another example is, so like, I hope you don't mind the people knowing like, your age range. So we're in our 40s.
Yeah.
And so in our 40s, we should start doing colorectal cancer screening. Okay. And so that means like getting a colonoscopy or, there are other forms of screening. By doing that, you can literally see a polyp and remove it right there, because a polyp can actually turn into cancer. Okay.
So both of these screenings, whether it was the pap smear for
women,
smears, colonoscopies,
yes,
these things, they can see little things that they can just treat right away, go home, you're fine.
Right.
Versus, now, how often would you suggest getting these screenings done?
So
Right?
it's different. It's different. And so, and that's another thing. This is where education is important, because like different ethnicities have different higher risk levels. And so, they found that, African Americans need to be screened sooner than other populations for colorectal cancer screenings, because, that's how we lost our Black Panther, Chadwick Boseman, to colorectal cancer. I don't know exactly what his specific situation was, but, makes you wonder if early detection could have, and there have been other situations like that.
Right.
So, knowing that's where knowing if I'm African American or Black and I have higher risk of this, and this, let me make sure I'm keeping track of what my levels are.
Rest.
Could I address something that you just brought up? It just sparked a whole bunch of thoughts.
Okay.
Is within our community specifically, and I don't know if this is within other cultures, but I know with friends and family, as we're getting older, going to the doctor to find stuff out is like taboo, right? And I think every behavior has a positive intention, So what they
Right.
associate is when I go to the doctor, I'm gonna get bad news, right? Or when I go to the doctor, I feel fine right now, right? I may feel a little off, but when I go to the doctor, then things tend to compile and snowball, all those things, right?
Right.
What I think we have to understand, we spoke about stress, it's not you going to the doctor that causes that situation to now be negative or be more impactful. It's how you view it. So the stress that you put on that visit, the stress that you take out of that visit, then makes you feel worse.
Yeah,
Right?
but then also remember there's a historical context there as well
Okay.
with Black people. There's for a lot of us, because of history and because there have been situations where we have been taken advantage of specifically in the medical field. So in the medical field, where it's supposed to be the ultimate pinnacle of a trusting
Trust,
relationship. And we've been horribly taken advantage of. The Tuskegee experiment is an example where
Exercise.
we were supposed, so where, so there's overall, there's a lot of mistrust of, people in our culture who, don't trust doctors because of, the way that we were taken advantage of, in the past.
So the way to prevent that would be actively finding someone that you trust.
Exactly.
Right. That's
Super
that's
important.
A huge part.
And for some people, in these days, some people are feeling more empowered to say, I want a Black doctor, or I want an Asian doctor, or I want, some people feel that having a doctor that has the same culture, that there are some underlying understandings that they may have, but not to say that a non-Black or a non-Asian doctor won't have that cultural
Okay.
competence. So I don't want people to think that I'm saying that.
Right.
But in general, you want to find a doctor that, first of all, because trust is so important, because you're not gonna, if you don't trust your doctors, you're not going to follow through on anything that they're recommending. If you're just going to the doctor and they tell you things and you're like, oh, they're, and you have this kind of hang up and you don't feel comfortable sharing that with them, you're not going to follow through on what they're recommending. Exactly.
You don't trust them.
Exactly.
So it's very important, because I think, and I had a friend the other day who was looking for a therapist, and she worked with one person. And then she didn't really feel comfortable, so she ended up switching. And I don't think that we understand we have that level of autonomy, right? Sometimes we think just because this person is in the place of power or the, influence, we think just because this is the first one I'm seeing, that's the person I have to stick with. No, you have to make sure, right?
That is so true.
You have to make sure that you trust your physician, and you have to make sure that it's like they understand you and you understand them.
Right. Especially, and that's such a great point, especially with, with all types of doctors and providers, but especially in the area of mental health, where you're getting even on deeper levels of discussions and, talking about, addressing like, traumas and, so you're getting very vulnerable. The only way you're gonna get anywhere in these types of settings is by, being transparent and vulnerable. And if you don't trust the person, or there hasn't been like some type of positive rapport that has been built, it's not gonna go anywhere. And so I always tell my patients that, if you're feeling like, give it a chance, give it sometimes it takes more than a few sessions, but give it a chance. But if you feel like there's not going to be a good connection and you're not going to be able to open up and be honest, and there's no trust, you absolutely have the right to request a different doctor or a different therapist.
You know what is insanely important to me, what you're highlighting, correct me if I'm wrong, transparency and vulnerability. You can't have a good rapport with anybody that's working with you if you don't trust them enough to be transparent and vulnerable. Because that information you don't feel comfortable sharing is usually the information that's the most important.
Right.
And we'll go side to side. And it's funny, I think even when, and I think we all work hand in hand as wellness professionals. We're talking physicians, therapists, trainers, physical therapists, right?
Right.
And the important part is making sure with whoever you work with, if you don't feel comfortable enough sharing what you need to share with them, chances are it's because there's some level of disconnect, there's some level of lack of trust, and then that's probably a sign to go find somebody that you feel more comfortable sharing with.
Right, absolutely.
Yeah.
Absolutely.
And what do you do specifically for preventive health in terms of like just day-to-day being aware? Not specifically it's like what exactly you do, but what are some of the mental checks that you do? Like, okay, should I make sure I go get a screening? Should I make sure that I'm taking these particular vitamins? Whatever it is. Are there any mental checks that you do?
For myself?
Yeah, for yourself.
Right, because I got to practice what I preach,
Yeah.
right?
Yeah, right. The mental checks. You got that.
Right. So for me, I think that exercise is a huge part of my, kind of wellness picture.
Rest.
Again, like we said, incorporating strength training in addition to cardiovascular, but also a really big part that's super helpful for me physically as well as mentally is like doing some type of like yoga or stretching, breathing exercises really help to kind of reset my stress response system.
Yeah.
Because, in a high stress profession, those catecholamines and cortisol levels are shooting up. And so and this is good for everybody to know, doing deep breathing exercises and, having a mindfulness practice where you're, doing some grounding and, we can talk about that later, but in general, it's kind of a good way to reset the body, reset the brain, and to, kind of stay calm. So that's
Huge, real quick. People have to understand that's not woo-woo. Right?
It's not what?
It's not woo-woo. How people look like, oh, you doing that woo-woo stuff, you meditating, you're doing no. Those things scientifically help to lower stress levels, right? Because when stress levels are high and cortisol levels are high, then, immunity starts to break down. All these things that happen.
You are preaching right now. Here's the thing. This is going to be a little controversial for some people, but especially, I'm going to just be personal, especially in some cultures and communities and even
Exercise.
faiths, the terms mindfulness and even yoga are kind of taboo and they're kind of frowned upon because it seems like it's, for various reasons. But I just try to tell people it doesn't have to be a spiritual thing. It's more so because what you said, the studies have shown that doing these exercises you don't have to do chanting and all of the a lot of people equate those with just you're chanting and you have sound baths and you're doing all these kinds of it doesn't have to be all that. It's but the practice of deep breathing and stretching and aligning the breathing with body movements really has proven to decrease immunity or increase immunity. Improve cognition, releasing brain chemicals that are helpful for that are neuroprotective. So many physical things. And cognitive, benefits. And so, but so many people are shunned away or kind of shy away from those things that could truly be super helpful for them. So that, to me, that makes me a little sad when I hear people being discouraged from those things that could be helpful for them.
You know what it speaks to though is the mindset, and we're going in specifically highlighting preventative health versus reactive health. Is we're so used to instant gratification, right? So those things aren't going to work on just Monday, right? You have to do those things consistently.
It does have to be
to see the benefit.
Yes.
And now we almost built this level of comfort to, I go get a shot, I feel better.
Right.
Or I go take this medication, I feel better. But we have to remember that instant gratification is not going to always help in the long run.
Right.
So it's now developing an appreciation for delayed gratification, which is much more sustainable, much stronger, and it will help in the long run.
Right. So another thing that for my personal wellness and, again, backed up by studies is, and this may not be as obvious for some people, but this is more so for like mental wellness as well as, so when I say mental wellness also, please understand that mental and physical are so closely intertwined. So, just assume I'm talking about both.
Right.
But interesting studies have shown that making sure that you're maintaining good, healthy relationships, which was what we talked about before, but healthy relationships, staying closely connected with people, if you're a person of faith, staying involved in your faith communities, that actually really has a super positive impact on health and wellness and disease prevention that people may not realize as well.
Yeah. I mean, that was such a good topic when we're talking about healthy relationships, because what people don't realize, and we have this mindset that if somebody is a close friend or family member, we're not allowed to set boundaries. Right? We spoke about this before. And now we can correlate it to this discussion where setting those boundaries are not to necessarily treat them wrong or to enhance conflict. Essentially, it's just to prevent any negative impact on your stress levels and to therefore protect your level of health and quality of life. Right? You have to remember that. So a lot of times setting boundaries and making sure that you have healthy relationships is only to help be more conducive to your overall health.
Right? Absolutely.
And I think people appreciate that after a while because it becomes infectious. To other people. What have you noticed in working with children as far as belief systems or like, let's say, prevalent beliefs that kids have in regards to how they take care of themselves?
It's so interesting because, in this day and age, social media has really, so like for instance, the kids that I work with today, I've had to kind of change my approach in a few ways compared to kids that I worked with, 10 years ago. Because for instance, like on TikTok is super big now, and on like all of my kids, whether they're patients, family members, nieces, nephews, everybody's on TikTok, and they all so they're learning a lot of things on TikTok. So a lot of my discussions with a lot of my especially teen and preteen patients is they're bringing me things that they learned on TikTok.
Okay, this is good. Okay.
And so sometimes I'm spending my time, fact checking with them and educating. But the good thing is that there does seem to be more awareness about like mental health issues, physical health issues, and they're like interested, intrigued by these things that they learned on TikTok. But sometimes they're factual, but then sometimes they're not. And so a lot of the discussions may be, like helping them to, kind of weed out what's true and what's not.
It's funny, but what I've also noticed is, TikTok is, I think, penetrated a lot of different professional fields. Is that sometimes they just take it out of context.
Exactly.
So they have information, but they don't understand all the nuances and the layers and the depth of that information that they brought for you to be able to explain. So like somebody come into me and said, I need to start lifting weights to build boldness. They heard it on TikTok somewhere, right? And I'm like, yes, but you still have to build to be able to do that, right? So you have to have proper form, you have to have proper body mechanics, make sure your core is engaged. So there's all a bunch of these like little nuances that go with that information that you heard. And I'm sure you see that, like, yes, that's right, but.
Yeah. So for instance, if a person, I'm trying to give an example that doesn't give away too much private information. In general, if someone sees, like a friend has a certain diagnosis and they looked it up and they think they have that same diagnosis, but their life, and this goes back to, what we talked about before, like social determinants of health. They have completely different life experiences. They have completely different, risk factors. And like, no, you don't have what that person has because you are a totally different individual from that person.
Right.
Even though you may have similar symptoms, you actually have this and not that, but based on what they learned on TikTok. And I'm purposely not saying specific things because I don't want to open a can of worms, but there's like you said, nuances that people don't understand. Like, so that is the challenge with, I love for my patients to be educated and empowered, but then also, but also I encourage them to bring it to me and let's talk about it because, that may or may not be accurate for your situation, and so.
So it's almost like explain to people, cool, get your information on Instagram, TikTok, social media, Google, but don't use it as a final determinant. It shouldn't be definitive. It should be a starting point or a foundation for you to have these conversations with a professional who can now explain these to you, right? So it's like, oh, okay, cool. I found out that my friend has these symptoms and I think I have something that looks similar. It's not like, okay, I've diagnosed myself.
But some of these they diagnose that they are convinced that this is what they have. They're ready to fight. Like, no,
this is it, right? And then I mean, also too, I think both of us believe like if you really put yourself in that mindset that you have it, it's not going to be helpful, right? It's not going to be helpful at all,
right?
Which is so important. And what I think is making preventative health just as inclusive as you can.
Yes.
So there's not just the holistic approach, there's the getting the screenings, the vaccines, anything that, and we always be careful with vaccines. We're not saying to go get vaccines. We're saying that if you do your research, you have conversations, and that's an option that you feel is necessary, okay, explore that, right? In addition to exercise, all these things all just revolve around just being aware, constantly checking in, right? And I think an important part is a lot of us move day to day without an understanding of how we feel. Take note of it, right?
So
take
important.
note. Where's my energy level on a consistent basis that I'll notice when there's a shift, right? When I'm like, you know what? I've been tired, even though I've been getting enough sleep for 6 days straight.
Right.
Okay, so that means that something must be up. Let me start doing mental checks. Let me try to go to bed a little bit earlier. Whatever it is.
Self-awareness is super key in the whole world of preventing, disease, in preventative health. Self-awareness, super important.
Self-awareness, which is big. And I think also too, going back to communities, having those check-ins with yourself and with the people around you.
Right.
Because you don't want to have the people that are saying like, don't do this, don't do that, because then that's going to influence your daily decision making.
Right.
Which is very important.
Right.
Yeah.
Absolutely.
Yeah.
Absolutely.
Is there any, I know, and I'll say for me specifically, the things I pay attention to are my energy level. And what I think was cool with working out is, kind of seeing where I'm at as far as like my strength and my endurance. If those things start kind of suffering, I know to start, okay, let me start looking at food. Let me start looking at sleep. Let me start looking, okay, have I been exposed to any sickness? Was somebody had the flu or a cough? Like, so now I think when you're exercising and you're checking in, it allows you to be like, okay, is something off with me at this particular moment?
Right.
Yeah.
Absolutely.
Yeah.
And, what's next?
Yeah, bring us home. We good.
Oh, okay.
Make the point. Bring us home.
Well, so, just kind of so going back to like, ways that we make sure that we're like, what do we do to keep ourselves healthy? I'm definitely not perfect. So, healthy eating is a huge part of, preventing chronic disease.
Yeah.
I struggle in that area. You know it.
That's why
I'm gonna be transparent.
You're looking at me like, I'm not perfect, but I'm saying.
No, but I think it's important for people to understand that, you know, there are some areas that, you know, maybe you really want to indulge in some areas that may not be so healthy, but, you know, changing of health, you know, eating habits. I've found ways to try to balance out my, you know, the areas of unhealthy eating that I tend to indulge in. I try to balance it out. You know, maybe just do that on weekends. If I absolutely have to have that ice cream, you know, try to limit it. I think also, you know, the people aren't gonna like this one, but super important, smoking cessation, stop smoking if you do smoke, and, you know, because that's huge impact on chronic health disease and development. Alcohol. The people are not gonna like this, but alcohol, you know, moderate alcohol intake is, you know, okay, but, you know, chronic excessive alcohol consumption has, you know, huge impacts on development of health, you know, chronic health disease, cancers, liver problems, high blood pressure, diabetes, all can be related to excessive alcohol use. And sleep I'm a sleep evangelist. I love to promote the benefits of sleep. And so sleep deprivation, chronic sleep deprivation can make everything worse. From, you know, how you're thinking, how you behave, and it also has connections to chronic disease development as well. And so, and then also I have to drive home, really, you know, there's so many stigmas about like mental health and like addressing mental health. Please make sure that you're checking in with and making sure that you're addressing your mental health issues. If you're burned out with work, dealing with anxiety, depression, you know, a lot of other things that can happen. Make sure that you're addressing that, because that has, like, not addressing mental health issues also has
a chain effect.
Severe impacts on overall chronic physical health disease. So that's my take-home message.
No, it's either like when I asked you to take us home, I didn't know you was gonna really take us home. You know what I mean? Like you. I mean, that's the way you bring it home. That's perfect. And I just hope that people really listen to being mindful. You should be aware of your consumption. If you're not aware of your consumption, then that's the starting point to start.
Right.
You know?
Right.
All right. Till next time.
We did that.